Hi, this is Dr. Singarvedi from Empower Psychiatry and Sleep. What is prior authorization that is done by your doctor's office for certain treatments, for certain prescriptions, for certain procedures? Prior authorization is a process where your physician or physician's office sends a specific information pertaining to that particular treatment, that particular medication, that particular procedure to your health insurance company in order for the health insurance company to approve or deny that treatment. Now, this process is implemented by the health insurance company. Although your primary decisions regarding medications or treatments are made by your physician, the health insurance company dictates in terms of approving a particular medication, particular treatment, particular procedure, or particular surgery. One of the reasons that we all know why they have this kind of administrative process is to minimize their costs in terms of paying for these treatments, these medications, or procedures. In psychiatry, we face at least clinics like us where we provide TMS or transcranial magnetic stimulation as well as esketamine or Spravato for difficult to treat depression or OCD. Both of these procedures or treatments, by that I mean transcranial magnetic stimulation or TMS as well as esketamine or Spravato, require prior authorization by most of the health insurance companies. When we feel or when we decide that a particular patient is likely to benefit with TMS and or esketamine or Spravato, our ability to get these treatments for such a patient depends on one more step, which is getting this prior authorization completed and approved by their health insurance company. This takes substantial amount of time in order to get that information put in either a hard paper format or an online web-based questionnaire that we have to complete and submit it to the health insurance company. Depending upon the health insurance company, the response seems to vary anywhere from few days to sometimes as long as 2 to 3 weeks, where either a nurse or another such trained agent typically reviews and approves or denies such treatment. In some cases, when they are denied, our office or other physicians or providers' offices typically would try to appeal it. And sometimes it may require a peer-to-peer review. By that I mean a physician from the health insurance company and a physician from our practice like me or other providers' offices. They have a conversation in order to make a decision regarding approval or not for that particular prior authorization request. This whole process can take substantial amount of effort and delay in terms of getting the actual treatment approved and started. But so far, this process has continued and is likely to be there for several more years going forward. Thus, knowing about it rather than getting frustrated makes much more sense. And we try to gather as much information pertaining to this process at our patient's first visit if we are thinking about TMS or Spravato treatments in them. Thank you very much. This is Dr. Singarvedi from Empower Psychiatry and Sleep.